Hello SWG640. Our group was assigned narrative theory, and we will be discussing the practice principles, examples of practice settings, and strengths and limitations of the theory. The practice principles of narrative theory are: 1. Storytelling is an individual's way of sharing their life experiences. 2. Being able to share their story can be therapeutic by being able to attach significance to their experiences. 3. Throughout telling their stories, clients can evaluate their experience and shape their perspective of life events. And finally, externalizing life experiences can be a way that clients are freed from experiences that have been influenced by a dominant narrative. For example, in her TEDx talk, Sabotage discussed how she and many of her friends were treated ill due to Islamophobia following 9/11, and are still experiencing those perceptions from others today. This dominant narrative has influenced her perception of self throughout her life. Her art is her narrative. To be able to share her experience as a Muslim post 9/11 in America, an attempt to humanize Muslim women in others' eyes. In other words, she attached meaning to her narrative through her art to accomplish reshaping her perspective of self and how others view people like her.
One instance in a group setting where narrative theory can be used is Alcoholics Anonymous. To look at how narrative theory intertwines with Alcoholics Anonymous, it is vital to look at the Big Book, which is the handbook for the program. It is required for all members to live by the 12-step program laid out in this book. It also uses real stories from past participants and rhetorical stories to help others tell their own stories in a therapeutic anonymous group setting. AA is a safe space for alcoholics because the Big Book makes it okay to share your experiences through thought and group therapy. One of the most famous stories that the Big Book tells is about the jaywalker. As the story goes, there is a man who cannot stop jaywalking. He is literally addicted to jaywalking. People keep telling him that he needs to stop, but he refuses, continuing to risk his life so that he can jaywalk. He eventually loses everything. He is constantly getting hit by cars, and because of this, his support system leaves him. This ties into narrative theory because it allows us to express through rhetorical stories how drinking can be so detrimental it can ruin someone's life. It parallels to that of an alcoholic's life, which allows them to connect to the story and express their own troubles in a therapeutic setting. As a part two of how AA uses narrative theory, we'll explore how clients and family members are able to express themselves through story. The two types of meeting, both opened and closed, allow this to happen. In open meetings, the public may join in recounting their own experiences living indirectly with someone suffering with alcoholism, as well as the alcoholic themselves, where they can tell their stories in that group setting. On the other hand, clients are only allowed to be at closed meetings. Narrative theory runs these meetings as everyone is allowed to find therapy in a group setting when telling their own stories, guilt-free and without judgment.
Additional practice settings with diverse groups include the following. In Singapore, at a local social service agency, social workers created a narrative therapy group for children suffering from violent households, with the hopes of decreasing the influence of violence and increasing the children's resiliency. One of the interventions used was a technique called My Happy Ending, which prompted children to write stories about their hopes, dreams, ambitions, and skills. Externalization was also used as a technique, which is a separation of the client with their presenting problem. Another practice setting was at a hospital program in Korea where adolescents with schizophrenia used narrative therapy to improve their communication skills. Clinicians provided therapy for a year and implemented the use of everyday narratives and the sharing of stories to increase the adolescents' language skills. A school therapy group in Iran worked with children suffering from social phobias. Clinicians provided therapy to assist the children with externalizing their phobias and developing social skills. Clinicians use storytelling techniques, including the feeling words game, which helps children identify their thoughts and feelings, and metaphors and fairy tales, which helps children develop new ideas for behaving in different social situations. Lastly, in a hospital treatment program in Australia, Clinicians used narrative therapy with children suffering from chronic pain. Therapy goals were to distract the children from their pain and help them gain control over the intensity of their pain. Clinicians used externalization by having children create drawings of representations of their pain. In the top right corner is an example by a 15-year-old who describes his chronic pain as always lurking and relentless.
We will now discuss strengths and limitations of narrative theory and its role with diverse client systems. Beginning with strengths. One of the strengths of narrative theory is that it complements other therapies. Eclectic practitioners can combine narrative therapy with other preferred therapies such as empowerment theory or biological model. A psychiatrist by the name of Lewis stated, "Taking a narrative turn does not mean abandoning the biological model or any other. A narrative turn says all the models are valuable and if used self-reflexively in dialogue with patient and in the service of recovery." Narrative therapy used by psychiatrists can improve the dialogue between patient and physician. Additional strength is that narrative therapy can be meaningful to clients. Due to the use of storytelling, the therapy is comfortable with multiple groups. In the textbook by Langbury and Litz, it stated that older adults often find the sharing of narratives to be a meaningful process. Discussing a diverse client system, practitioners working in hospice settings can utilize narrative therapies to help clients who are faced with end-of-life issues achieve closure through life review activities. Narrative theory is also interested in meso and macro practice, making it ideal for practitioners concerned with social justice issues. In an article by Combs, it stated, "Becoming a narrative therapist involves learning how to bring forth the knowledge and skills of people who come for therapy, and how to do that in an influential but decentered way. Because of its focus on the discourses of modern power, narrative therapy helps the therapist be especially attuned to issues of social justice." This means that practitioners working in refugee centers are able to hear client stories through narrative practices. In this way, practitioners will be able to identify systems of oppression and be part of the meso and macro interventions needed to support refugees. In closing, narrative theory does have some limitations. Langer and Litt states that it lacks support as an evidence-based practice. What this means is that further research is needed to establish narrative theory as an effective practice. Quantitative studies could be considered within diverse groups to support the effectiveness of the therapy. Lastly, narrative theory may not be appropriate in managed care settings. This can limit diverse groups from receiving the benefits of narrative therapies. Consider state-funded mental health programs for private practitioners. The lower socioeconomic class is not likely to afford private practice offices where narrative theory is being practiced.